Welcome everybody, this is Andadi Rehab channel and today we are going to discuss about fluency disorders. So I'm a speech language pathologist. Over the past few episodes we have discussed several topics such as autism, language disorder and screen time, milestones and everything. So today's topic would be fluency disorders. In order to know what is fluency disorder, we have to first know what is fluency. So fluency is something that flows. So when we say your speech is fluent, we mean that they are talking in a very uninterrupted way. Their speech is just flowing. There is no abrupt interruptions or there are no pauses. There are no long pauses. So that is what we mean when we say somebody is fluent. So what is a fluency disorder then? So in fluency disorder, the speech of a person gets interrupted, it gets stuck, it gets disrupted in between. So it could be like words are not coming out of their mouth. It could sometimes be like long pauses. It could sometimes be long fills, which is voiced fills. Sometimes people used to think and they just used to utter like they use such fillers. So these fillers also tend to disrupt the fluency of speech. So how do we say somebody has a fluency disorder? Because nobody is 100% fluent in this world. Everybody's speech gets disrupted. So somebody is not very prepared for their speech, or somebody is on their speech will be interrupted and disrupted. So which means they have stuttering, or which means they have a fluency disorder? No. So how do we classify that somebody has a fluency disorder is if somebody's fluencies exceeds 15% of the time. So for example, if somebody speaks 100 words and 15 words are disfluent, 15 words are getting disrupted, stuck and interrupted, then we would call 15 or more. So then we would call, it is a fluency disorder. Their speech is, not flowing and stuff. So fluency disorders are very, very common. It it starts right from childhood for many of them. So even adults who stutter, when they come to us for assessment and everything, when we take the history, they say, I stutter from 5-year-old. I start stuttering when I was in high school and everything. So the origin starts right from the childhood. And what causes stuttering? Everybody wants to know this because, during therapy sessions and during assessments also, they are very curious. He was very fluent all this while. Suddenly he picked up stuttering. What do you think would have caused it? Is that what, parents ask us, and a lot of other stutterers ask us. And what actually causes stuttering are two things. One could be genetic, because the genetic makeup, if it carries the genes, the child or the individual will stutter. If it runs in the family, then it can be a possibility. The other reason is neurological. So what is neurological? There are some differences in the nervous system and the brain of a person who stutters. So they are very, very mild differences which will probably not even pick up in MRI and CT scans. Only like functional MRIs and only in research which are pertained to look for only these will find out all those differences. In regular CTs and MRI, we will not have any marked differences from that of a stuttering person's brain and a typically developing person's brain. So the causes are two, genetic and neurological. And the next question would be whom to approach, because as I said, stuttering is a very, very common speech disorder. A lot of people have stuttering. So if you when I I'm talking about this topic itself, you could have, thought about somebody, some neighbor or some relative or somebody who you have met, your acquaintance, or a person who have met at the shop or in the bus. Somebody would have had stuttering. You would have definitely come across them, because it's very common. And when I say it's very common, the treatment is also, it's very diversified, and we see the treatment for it everywhere, right? So there are a lot of promising treatment approaches in the market, but they are all not research oriented. They are all not evidence based, I would say. So the only treatment approach which is pakka evidence based is speech therapy. So whom they have to approach is a professional speech therapist, and the speech therapist will be assessing their speech and then will be guiding on how to make their speech more fluent. There are some like edible treatments and all, like medicines and everything, but those all don't tend to work for stuttering, because stuttering is a complex neuromotor speech disorder, right? So when I say speech disorder, it can't be rectified by having something. Speech is a function, it's a functionality. You have to improve your speech by practice. You cannot improve your speech by having something or drinking some drink or anything like that. Okay, so the speech therapy principles are also based on speaking only. So only by having the right kind of techniques on how to speak better, how to modulate your breath and your speaking, your speech will get better eventually. So the thing with practice and speech therapy is that it takes time, and a lot of people in the current world are in search of quick fixes. Speech therapy doesn't work that way. It takes time, effort, and consistency. And so as I said, there are a lot of promising treatment approaches everywhere on the internet, but the only research-based practice is speech therapy. So you'll have to consult with a speech language pathologist, get yourself, or the person whom you're suspecting to have a fluency disorder, get their speech evaluated and start speech therapy. Usually for speech therapy, for stuttering, we would recommend like weekly twice, not more than that. And then slowly, we'll fade off depending on the improvement. So there are different types of fluency disorder itself. So the one is the very popular one, stuttering. We all know stuttering, stammering. We all have seen. There is another type of fluency disorder which is called cluttering. So, and there is another type which is neurogenic in origin. So somebody who had brain trauma, like due to a stroke or due to a road traffic accident or any neurogenic condition, after that condition happens, their fluency will be interrupted. So there are fluency disorders which are neurologic in basis, and the other things are stuttering and cluttering. So cluttering, it is characterized by a very fast rate of speech, and people with cluttering, their features are they're generally clumsy, and another prominent feature is they are not really good at academics. Their language skills are also very poor. The way in which they narrate, the way in which they formulate, they ideate, all those will have some differences. So if we ask the person with cluttering to say a story or narrate an event, so they won't be able to do it in a coherent way, in a sequential manner. They'll say something here, something over there, and they'll just miss the important crux of the story itself, and stuff like that. It will seem like they're talking a lot, but their speech won't really make sense. So these are some of the striking characteristics of cluttering. So now moving back to stuttering, as I said, stuttering begins right from childhood, And during childhood, what becomes tricky is that there is something called normal non-fluency itself. So normal non-fluencies occur from 2 years to 3.5 years for almost all children, because when children learn to speak, they all cross this path. So at the age of 2.5 and all, most of the children have some kind of disfluencies, at least for some part of their life. Maybe for like they quickly grow out of it, so we don't even realize that they are stuttering. So for few children, it will just last for few days or few weeks, and that's all. They grow out of it, and we won't even realize that they had this kind of disfluency. So that's why we call it normal non-fluency. They quickly progress and they grow out of it. Mostly these kind of disfluencies happen because of the huge language spurt. Their vocabulary grows exponentially post 2 years of age, and these kind of stuttering happens because they're confused. We don't call this stuttering, we call it normal non-fluency only. So they're confused on what words to use. So should I call this a red top? Should I call this a t-shirt? Or should I call this a some U-neck top or crop top? So what should I call this? So these kind of dilemmas will cause those normal non-fluencies. Mostly it is related with language, on how to choose the words and everything, and the children quickly grow out of it. It's like their brain works way faster than how their oral structures, their speech organs work. So those might cause a normal non-fluency. So stuttering also emerges in childhood, as I said, and the trick is differentiating normal non-fluency from stuttering. So what I would say is, if the disfluencies are occurring more than 2 months, so it's been going on for months and months now, and that is definitely indicator that we must go see a speech therapist. Or if you feel that it is progressing, so beginning 2 weeks ago he wasn't stuttering so much, now he stutters so badly. So beginning 2 weeks ago he just said water. Now he is saying water. So you can see the progression very evidently here. So if you feel it has been there, the disfluencies are there for months together, now it is not fading away and it is progressing as well, then these are clear indicators that you should meet a speech language pathologist for getting the speech assessed. Okay. So in stuttering, when we assess, we see what are the disfluencies are present in their speech. So few disfluencies are, repetition of syllables, repetition of words, repetition of phrases, and few children prolongate. So for saying mango, they might say mango, or the repetition of syllables is something like mango. Repetition of words, something is like I want two mangoes, something like this. So these are all some types of disfluencies which we commonly encounter in children. There are also other types of disfluencies like blocks. Those are usually encountered in adults, I would say. So blocks is when they are fixated in a position but the sound is not coming out. So for example, if they want to say paper, they'll keep the lips pressed but the sound won't be coming. That is block. And in adults, what happens is they might also have lot of facial concomitants, lot of hand gestures, leg gestures and everything accompanied to when they are stuttering. Yeah. So in childhood or adulthood, both cases, when they become aware, when the person who stutters, what happens is that they are very conscious. They tend to avoid speaking to certain people, or avoid speaking in certain environment that calls attention towards their speech. They tend to remain silent, they won't mingle and make friends, socialize and everything. So it has a deep layered trauma, right? So they want to speak, they know what it is, they have points to discuss, but they won't speak because of this issue, which is really bothering them inside their head. So it is we call it as like a iceberg phenomenon. So because what we see from outside is only the stuttering, what they undergo through inside is so much more. The emotional component is very heavy, and in children they sometimes get bullied at school by friends or even by teachers. They sometimes get intimidated. So they feel frustrated that why this happens to me and everything. The same goes with adults as well. So sometimes if teachers point out at them and ask questions, they feel like, oh my god, I'm so bad at this, I'm not able to talk, and they feel all this inferiority complex and everything, right? So it is a very multi-layered thing. It is not just speech, right? It is deeply intertwined with their personality, their emotions, and so much more. And it affects their socialization, and just getting them early diagnosed and intervened will have a really good impact throughout their life. And the intervention is not only in our society. What happens is people think they'll grow out of it. Children just grow out of it. He won't stutter in the future. That's what they think. But when it progresses, the child undergoes all these every single day at school, bullying and harassment and everything, and it becomes a very deep trauma. So what I would recommend is, if you encounter the signs and scenarios, please do consult a speech language pathologist and get intervened, and that will make a lot of difference to the child and to the whole family as well. So I'm happy to take if there are any questions.
Yeah, hi Vaishnavi. Looks like we have a question from Rajiv that, but it is regarding elderly people. So,
So
uh,
what happens is, there are in stuttering there are severities. So mild, moderate, severe. In adults, if the stuttering is really severe, what we'll first work on is to tone it down to bring it to mild or moderate. So that is where we'd first work on. I wouldn't say we can cure stuttering 100%. I wouldn't recommend. I wouldn't say that, but we can really work on the severity, and we can really work on to improve the speech fluency, the overall quality of life, improving their self-confidence and everything. Those all things can be really worked on in adults and geriatrics, elderly population, everybody basically.
right. And any other ways where we can tackle stuttering at home itself, like how can we help children
So for
from suffering from stuttering?
So for children, per se, I would give these tips to parents. So if the child who is stuttering is trying to say something, don't rush them up or don't hush them up. So listen to them patiently. If you don't have the time to listen to them patiently, just communicate that clearly. Give me 5 minutes and I will listen to you. So give them a very elaborate time so that they don't feel the need to speak it quickly, and that's when they'll keep stuttering. That's when the anxiety will shoot up and everything. Yeah. So for parents, this is what I would recommend. But definitely along with all these, go for speech therapy. That will only have a bigger impact. So I think we have come to the end of the session. Thank you so much everybody for attending, and keep following the space for more.
Thank you for watching. For more such videos, do like, share and subscribe to the First Parents.